So what do patients experience as the treatment is ongoing? Well, the first thing you'll be aware of is that you'll be laying on your left side with your knees curled up towards your chest, and there will be a small tube called a proctoscope inside the anal canal, and that can be a little bit uncomfortable, the actual act of popping it inside, but we use a lot of lubrication to do that. Once you've got the proctoscope in sight, we will be able to identify the hemorrhoid we're going to treat, and then we will apply the tips of the probe on the base of the hemorrhoid at the point that we want to target, and then slowly increase the current. So as the current increases, some patients will be aware of nothing apart from the fact that the tube is in place. Others will be more sensitive, and they will be aware of a little bit of aching, some stinging. Some people describe it, some people just say it feels weird without being able to articulate exactly what it is they're feeling. And some patients in certain areas may get the sense that they need to have a wee, which is one of the reasons we always ask patients to empty their bladder before treatment starts in case they get that particular symptom. And that's because it's electrical current, it's stimulating a particular nerve that gives the brain the message, I need to pee. You don't, and we talk you through that and reassure you. We haven't had any accidents yet, and we've treated thousands of patients. So that's during the treatment. At the end of the treatment, when the current is reduced and the proctoscope is removed, you are aware that something's happened, but there shouldn't be any significant discomfort at that point. So some patients may get a bit of pain during the treatment, but it usually stops as soon as the treatment stops. When they get up, they get dressed, and then usually within a few minutes they're feeling much better, and onwards and upwards with the rest of their day. So the healing can take place slowly over the next week to 4 weeks. And during that time, the symptoms that you present with can improve to a greater or lesser extent, depending on the severity of the symptoms that you present with in the first place and the size of the hemorrhoids. But more than that, it depends on the breadth of the hemorrhoid from an anatomical point of view. So the narrower it is, the more likely it is to respond more dramatically to the treatment undertaken. For example, we have had patients with grade 3 and grade 4 hemorrhoids that have very narrow bases that have responded to one treatment alone. But we have had patients with smaller hemorrhoids that are broader based that have needed more than one treatment. And indeed, the majority of patients with larger hemorrhoids, where they've been there longer, tend to be broader based and tend to require more than one treatment. However, across the breadth of the patients that we do treat, on average, overall, less than 2 treatments required. So that gives you some indication as to the positive nature of the treatment on addressing the symptoms. Some patients, though, after they get off the couch, they'll feel better straight away. Others, it will take up to 4 weeks before they get the full benefit of the healing and the symptomatic improvement associated with that. Having said that as well, there are some patients who after 4 weeks don't feel a lot better. And that's usually those with those broader-based hemorrhoids, where a further treatment is going to be required to really make a significant impact. And then a smaller group of patients may need more treatments than that to get that full symptomatic improvement that they're seeking. Some of the symptoms will improve better than others. So for example, bleeding is one of the symptoms that tends to respond quite quickly to treatment. Whereas if you have prolapsing, usually those are grade 3 hemorrhoids, that can be a more difficult symptom to resolve in one go, as I said, particularly with those broader based lesions. If they're narrow based, they can go in one hit. And when we look at patients after 4 to 6 weeks after their first treatment, irrespective of the improvements that they may or may not describe, we can see differences inside. And there have been patients who have presented with 3 grade 3 hemorrhoids at the first visit. They've come back at 4 to 6 weeks for an assessment and further treatment because they've still got symptoms. And inside, 2 of those hemorrhoids have completely gone and 1 is still a grade 3. There are more blood vessels feeding into that area, which we can then target, and then usually we will see significant improvement in that hemorrhoidal cushion, and hence patients will see further improvement in their symptoms. Some patients, when they present to us for the first time, having thought about their symptoms, having asked about their symptoms, maybe having seen the GP but not necessarily, will have spoken to our colleagues on the phone to book an appointment. But it's not clear that whether what they're suffering is actually hemorrhoids. The assumption is that that is the case because of what's described, and an appointment can be booked. When the patient actually turns up on the day, they may have a certain amount of discomfort. They may actually be in pain already before getting anywhere near them. And it depends on the quality and the cause of that pain as to whether an assessment can be carried out, an examination be carried out, and if appropriate, a treatment carried out. For example, a patient may present with what sounds like prolapsing hemorrhoids, and when they come, they have got anal skin tags, which aren't hemorrhoids at all, but that can be an interpretation. Now, some patients will have internal hemorrhoids that can be treated, but the skin tags won't go away. They would need to be removed surgically on a different occasion, potentially by a different surgeon who has the skills to do that. Some of the pain that they may present with may be due to aphysia, which is a split in the skin on the outside of the bottom, which is much more sensitive. And it may be due to a thrombosed external hemorrhoid or a perianal hematoma, which is exquisitely painful, and it may not be possible to undertake a full digital, let alone a proctoscopic examination to be able to assess the inside to know whether a treatment is actually appropriate for you on that day. However, what you will get is a consultation where some of these questions can be answered based on that assessment. And then we can recommend some treatments that might be topical, that might be a different way of assessing you to actually address those symptoms, and also given additional time, and a lot of symptoms can improve anyway. And then when the discomfort is settled, we may then be able to examine you properly to assess the inside, and then to determine if eXroid is an appropriate treatment for any internal hemorrhoids present, and then to carry out that treatment from that point.